Some people watching right now are sick with COVID. Some people are infected and they don't know it. Most of them will be fine, but our current rate of infection is frightening because on average right now, every case is leading to more than one extra case. And that's a chain that will lead to heartbreak for someone. 1.5% of Utahns live in the green and gray counties, and they saw a decrease from last week. Every red county set a new record in new cases. Purple counties got worse this week from last. Now, these purple lines represent cases per 100,000 in every county 2 weeks ago. Those were bad numbers, also setting records. But keep the purple lines on the map and compare them to these orange lines representing the latest numbers. 2 weeks later, the definition of uncontained spread. Put it another way, if you are in Weber or Cache counties right now, 1 out of every 83 people around you tested positive in the last 2 weeks. In Salt Lake and Utah counties, it's 1 in every 71 of your fellow residents. And in Garfield County, it's 1 in 80. In Sevier County, 1 in every 64 residents testing positive in just the last 2 weeks. And now, the whole state. These are daily averages, thousands of real people testing positive every day. The blue arrows here pointing to each rise in case numbers. Now add this orange line showing how many Utahns are dying on average each day. Again, we are outpacing the summer, but the troubling thing is this. Each of these red arrows extends from a peak in average cases to a peak in average deaths. Every one showing deaths increase about 8 to 14 days after cases. So our current 8.5 deaths a day comes from infections 2 weeks or so ago when we hadn't come close to 2,000 cases a day. Now imagine the red arrow that will extend from our current peak. And 10 days ago, Bob, you mentioned the hospitalizations. Utah 10 days ago had 410 COVID patients in the hospital, and today that's 512. Again, both of those were records at the time, and hospitalizations also lag. That means that this near double infection rate we have right now has not yet reached our hospitals, and that's what we're most worried about. Live in studio, Max Roth, Fox 13 News, Utah.